Good morning. My name is Jill Ratner. I am a primary care pediatrician. I work in Mount Kisco, New York, and I'm here today representing Hands Up for Haiti. Hands Up for Haiti is a nonprofit organization formed 6 years ago, and in that short period of time, we've been able to do so much because of our ability to collaborate and partner with other organizations on the ground, with the Ministry of Health, and with healthcare facilities in the area. Our major focus has been on improving healthcare, but specifically for children and women. I have served as the past president and co-founder of Hands Up for Haiti. I currently serve as the medical director of the medical committee, and I am on the board. Our board is expanded to be made up of medical professionals such as doctors and nurses, but also includes people from the business arena, marketing, accounting, and development. We have a large board, a large advisory board that also supports our work. We have a established, robust donor roster, as well as having grant support. I'm here today to, as far as myself, I should tell you that I've been in primary care pediatrics for the last 30 years. I serve as chief of pediatrics for the Mount Kisco Medical Group. In the past, I have served as chief of our local hospital, North Westchester Hospital, and I'm associate professor of medicine for Mount Sinai Hospital and School of Medicine. I'm here today to pitch for you our plan for helping the dire situation in Haiti in terms of infant mortality and maternal mortality at the time of birth. 57 of 1,000 babies die in the first year of life, and 35 of 1,000 women die related to pregnancy. Our idea is not a novel idea. It's been used in Nepal, where they have created local support groups of women that meet on a weekly basis, support each other in terms of knowledge and in terms of access to healthcare and typical practices of child rearing, and has been very successful in lowering the rate of infant mortality and postpartum depression. Our proposal is to take the areas where we are currently working, 4 areas in northern Haiti where we have malnutrition programs, where we run clinics, where we know the local leaders, and have the local leaders select a person from the community who can be an educator, moderator of weekly sessions with women to discuss issues of pregnancy, access to care, and what are the local best practices for rearing of children. We believe we can quantitate a difference in a short period of time through looking at access to prenatal care, by looking at breastfeeding statistics, by looking at number of deliveries with a birth attendant who is trained in neonatal resuscitation, and looking at seeing children in the clinics and in healthcare facilities within the first 2 days of life. Our goals are set that 90% of women will receive 4 prenatal visits, that 75% will have a trained birth attendant present, that 60% will be able to have their babies checked in clinics within the first 48 hours of life and will breastfeed for the first 6 months of life. Our teams are ongoing in Haiti. We send a team 10 times a year, almost once a month. We have staff in Haiti that make up 25 individuals who are both doctors, nurses, administrators, and support staff. And through that staff, we plan to have ongoing monitoring of our program, seeing how the women are accepting the teaching sessions, seeing how the facilitators are teaching the teaching sessions, and looking at whether the results are really panning out. This ongoing evaluation process is going to be very important as we roll out the plan at the 4 locations and then are able to expand it to other locations. The plan involves a 6-week training program, which Hands Up for Haiti will support with our local professionals. Our ask today is really for guidance and expertise in identifying possible partnerships both nationally and internationally, explore novel funding options, as well as traditional grants. We believe we have the manpower on the ground to make this work. We believe it's a simple idea that we've already established buy-in for as we've worked in these 4 communities and we've piloted the program in one of those communities. I really appreciate your input and listening to me today, and I look forward to the conference and coming and presenting more of the idea and hearing your response.